Welcome to the new and improved Work Comp Talk podcast. I hope you've had an opportunity to check out our new website because it is on point. And if you haven't done so, make sure you do so right after this episode. My name is Carmen, your host for today's podcast, and joining me is Bilal Kassam. And we have an amazing topic today. It's a topic that is really going to hit home for a lot of people that have been struggling in regards to their treatment in the workers' compensation system. And today, the reason why we're focusing on treatment is because there are a lot of denials that happen throughout treatments. So I kind of want to start it off, Bilal, first off with, what is treatment and what are you entitled to when you're recently injured at work, you've submitted your claim and you're ready for treatment? What does this look like for an injured worker here in California?
So there's two types of benefits in workers' comp. There's financial and then there's medical.
Mm-hmm.
It's really what it boils down to. And for medical treatment, you're supposed to have any and all care that you need to relieve or cure your industrial injury, whatever that may be. The issue in workers' comp that we run into the most is what is considered, reasonable and necessary care, which means the doctors don't have free rein to give you whatever, whenever they want.
Okay, so if I go in there and I say that I've been having headaches because I fell and hit my head, and then that my neck hurts, and then that my elbow got injured, it's not kind of like a woo-hoo-hoo, you get this whole gumbo package and you get service for everything?
Yeah, so when you go to your own doctor, right? If you go in and say, what's a good example of this? Like
allergies. I'm suffering with allergies.
Your allergies. They say, that's a shame. Like, here, let's do an allergy test. We'll swab your back. We'll see what you're reacting to. Yeah. If you break your arm, they say, okay, well, let's send you to downstairs if you're at Kaiser, right, to go get an x-ray done. Right. They get your x-ray. In 10 minutes, you go back up. The ortho looks at it, says, okay, we can just cast this. Then you go over and you get the cast put on. And then, granted, you're probably there for a while, but still relatively quick. A few hours later, you come out and you're like, cool, I got a cast on my arm and some pain medication, and they're sending me on my way, and I'll be back in
a few days,
weeks, whatever.
Mm-hmm.
Workers' comp doesn't work like that. The doctors have to request authorization for things. So when the doctor wants to do an x-ray, guess what? You got to ask for permission first.
So I'm going to be sitting there with my broken arm until I get the approved x-ray? Is that what you're telling me?
Yeah.
No way.
Yeah. So doctors, they have to request authorization for things. And it's not so much whether, literally they're allowed to or not, they won't get paid if there's no authorization. So if they do an MRI study and they didn't request authorization, there's a good chance they're not going to be paid for it at all.
Now, how often is it that a doctor decides to not treat someone because they know that they potentially might not get paid for it versus, hey, this person needs this right away. I'm going to take that risk and still give this person what they need and hope that I'm going to get paid for it eventually?
Well, there's a big difference in the medical treatment world about what's necessary to literally save someone's life, or
right.
if they're in danger of harm like that, versus care that's more like routine. If it's a back surgery, for example, mm-hmm. unless it's emergent surgery, you have to wait.
Damn. Now, tell me a little bit about this emergent surgery, because I know when my dad got injured, my dad was a garbage truck man. And this was recently when they had the little robots. It was like the whole new thing, the robot.
Big closet,
it picks up the trash can. So, that was a switch in their job. And then I remember my dad said that there was a bin that someone, yard waste, had left some long branches out, and the arm it wouldn't grab onto the bucket. So my dad got off the car and the truck and then tried to kind of maneuver the branches so that the arm can grab it. But of course, as soon as he maneuvered it to where the arm can grab it, it caught his hand with the bin and it started bringing him up with the bin. His finger was towed up. And obviously he ripped tendons, you name it. It was bad. He needed emergency surgery right then and there.
Something like that, that's going to be compensated. That's okay. We're not so much worried about that stuff. It's more so the people who they could get better with this treatment, whatever it may be, or maybe not. Or we think it's going to improve the care, but do they need it right now? Well, maybe not. And I think that's where the request for authorization process goes to something called utilization review, where you have this insurance company and you have people that basically contract with the insurance company, obviously being paid by the insurance company, deciding whether or not the care you need is going to be authorized or not. And so I think inherently there's a huge conflict of interest.
Right, of course. Now, how often do they say, nope, You're not getting, because I know a lot of the clients, at least, you know, from some of the attorneys we have here at Pacific Workers, which happen to be our sponsors, I hear a lot of like, hey, this person or this client is not getting their prescription authorized, or they stopped giving them the medication. Why do these denials come into play, you know?
Denials, you know, I couldn't quote you on the number of times things get denied. I couldn't tell you more frequently or not. I can tell you a lot of treatment gets denied, like a lot. And sometimes it's for negligible things, you know, over-the-counter medication, you know, nothing spectacularly special or that requires a prescription, just stuff like a heating pad, you know, or over-the-counter Tylenol, things like that get denied all the time.
That sucks.
Yeah, and it makes no sense.
You're limited on your funds, right? Because you're out of work, you're trying to recover, and even spending on an $8 to $10 heating pad, I don't even know how much they are. Spending that money is kind of like you're trying to make ends meet with whatever little they're giving you, and still having to pay for this on top of it. That sucks.
Yeah, and what's even wilder is like a lot of times the care that's denied is cheaper than the process of going through and having it reviewed and then ultimately filing the appeal on the back end to try and get the denial overturned. You know, they're better off most of the time just providing the care to the clients. You know, injured workers, if they had the basic care, they would be happy. And this stuff isn't, you know, exorbitantly expensive. It's not like, you know, they're being told you need fusion surgery all the time. It's going to cost $50,000, $60,000. A lot of times it's just basic stuff that people need to, you know, help alleviate some of their symptoms on a day-to-day basis. But, you know, the denial process, like I said, it goes through something called utilization review. And that process alone can take anywhere from 5 business days to 14 calendar days, depending on what's happening to get authorization for something. So, and that's if it all goes well. And your example earlier where you talked about the pharmacy, sometimes the pharmacy just doesn't get the authorization they need because you have a doctor's office that's actually requesting the pharmaceuticals. The insurance adjuster sends the authorization to the doctor, but then the client's going to a different pharmacy to actually pick up the medication. And so the client may go to the pharmacy may not be able to get a hold of the doctor's office or the adjuster. Then they're told, come back and come
Happens
back and
all
come
the
back.
time.
And we see it all the time. And so a lot of times it's like the left hand doesn't know what the right hand's doing kind of situation. There's too many people, too many parts involved to make the system move more fluidly for the injured worker.
Now, what does this utilization review do for you if, say, you just got denied a surgery and something that the doctor did want to perform on you, or say you need an MRI scan? And then the insurance company's like, nope, we're not paying that. It's too expensive, or it's going to add a lot. It's not necessary. How does that come into play?
Utilization review is basically there all the time. Anything the doctor wants to do, they have to ask for permission first. There's certainly exceptions to that, and there's ways to get around utilization review depending on what it's for. But for the most part, once utilization review issues a decision, if they say, yes, you can do this, and the doctor can go ahead and do it, and then they can bill for it, and they'll get paid according to, they call it fee schedule in California. If utilization review denies the treatment, then you have to go to a process called IMR. And IMR stands for Independent Medical Review. Which
we've done other podcasts on. I will link them on the description below as well, so you guys can dive into that, because that's a whole nother monster. So this happens a lot. You know, denials in treatment in general. What are some examples? I know we talked about, obviously, the medication. It gets denied constantly. What does it look like for someone who, say, needed emergency surgery for whatever reason? The doctor performed it, but then what happens if the insurance company says, yeah, that was not necessary, or they start questioning? Does that make things even more complicated?
A little bit. So there's a couple different disputes when we talk about medical treatment. There is the dispute about medical necessity, meaning whether the appropriateness of that particular procedure goes towards whatever it is that you're having issues with. So like if the doctor says, you know what, I had an MRI study of your spine. I can see there's, you know, multi-level herniated discs. We need to do a multi-level fusion surgery. We've tried conservative care. We've tried injections, PT. We have a EMG study. It's like a nerve conduction test to show that there's nerve issues because of your disc issues. Everything's saying like, this is the surgery that we need to do for this condition. You would say that's medically necessary and appropriate. The other question is whether or not that procedure or that need for that procedure was caused by the accident itself, which is also a separate dispute outside of utilization review, where they say, well, you may need surgery. That may be the appropriate type of medical treatment for your condition, but that wasn't actually caused by your injury.
Yeah. Show us the receipt. When was the last time you bought that mattress? And if you can't prove that it was recent, they're going to be like, it's your mattress.
Yeah. No, but we see that a lot too. And that's a dispute that's often brought up with what we call QMEs, qualified medical evaluators, agreed medical evaluators, and also the treating physicians sometimes. But we fight that a lot, and that's a separate thing from utilization review.
Okay, so what options do I have if I've just been denied treatment? I just got flat out denial, whether that was prescription or whether that was whatever type of, even physical therapy, right? The PT is something that sometimes they tell you need it, but then you go to the physical therapist clinic and they don't have appointments until next year. Mm-hmm. So it's like, then what? What are my options? If I flat out got denied for either prescription or medical treatment, then I go to the UR, the utilization review.
Yeah. And, depending on what's going on, there's different avenues to fight different things. If you're just talking about utilization review, saying no to treatment, then you go through a process called IMR, independent medical review. If that basically stands and upholds the denial, then unless there's a change in circumstance, the denial will stand for 12 months.
Yikes.
If your treatment is denied because of other things, and think of denial in a broader term, like denial of access, denial of opportunity as well. If a provider doesn't have availability, you can request a different provider in the medical provider network. If you disagree with your treating physician or, for example, a consulting surgeon who's not instilling confidence, like if you need shoulder surgery and the surgeon's like, I give it maybe like 50-50 that this makes you better or worse. Like, I don't know if I want to go do that, and so I might want to see a second physician, and you have a right to. You can go ask for a second opinion consult with a different surgeon to see if they're still recommending the surgery or if they're more confident that you're going to have a good result or a bad result, and help you kind of decide. And that's another, I guess, access point that you would want to fight for. And then depending on what kind of treatment it is, it may not even necessarily be treatment. We see utilization review denials for MRIs all the time, but MRIs aren't necessarily for treatment. They can be for evaluation only. And when a QME requests an MRI and they say, I need this to evaluate things like permanent disability and future medical care, it gets around the utilization review process.
Interesting.
So there's ways that you can either work with the treating doctor or ask for supplemental reports from QMEs to really clarify why it is that they're requesting certain things to see whether or not it really is treatment or if it's for evaluation diagnostic purposes.
Now, say I was the type of person that I'm skeptical about hiring an attorney, and then I don't hire an attorney until after the utilization review or until things get really, really messy. What are my odds of getting out of that one just because I hired an attorney? Is like too much damage already been done?
Depends on the timeline. All these things, not all of them, but a lot of times the things that you can do have strict timelines associated with them. So for example, you only have a certain amount of time to file an IMR appeal. You only have a certain amount of time as an insurance company to actually issue a utilization review decision, which, there's all these timelines and technicalities that can affect people's rights and the rights of the insurance company. We have cases all the time where they don't do utilization review on time and we can force them to authorize the care because they messed up. Mm-hmm. Just like it can work against them, though, it can work against the injured worker. And a lot of times, if you wait too long, you waive your right to things.
That's a lot. It's a lot to digest in regards to, the mess that happens when you get denied medical treatment. Have they ever flat out, I don't know, taken back a denial? Like, okay, wait, never mind. We're just playing. Just to kind of try to push someone to the limit to kind of say, okay, well, they said no, I'm going to give up easily. And then all of a sudden, hoping the person goes away. I'm assuming some people probably do go away and they don't even realize that they have a fight.
Yeah, I mean, most people don't understand the process. What's interesting, though, is there's competing principles in workers' comp that don't necessarily work together in the right way. An example of this is there's a difference between your disability status, meaning whether or not you've reached what they call maximum medical improvement, or if you're still off of work and getting better, you're considered, temporarily disabled. There could be treatment that all the doctors are recommending that it's actually denied by utilization review. But I've seen doctors say, until this person gets this care, they're never going to be MMI. They're never going to be maximally medically improved. I'm going to keep them on temporary disability. And there's actually case law out there that supports the doctor that the person's still entitled to temporary disability and isn't MMI, even if the treatment that's being recommended and sought has been denied by utilization review, which, that obviously creates a major conflict. And there's doctors that'll stand steadfast and say, I'm not going to say this person's MMI until that person gets that care. And I've actually seen adjusters override utilization review denials because of that. Yeah. So, shout out to the doctors out there.
Seriously, I was going to tell you, shout out to that doctor. I want that doctor to stand and say, no, I'm not going to give them what they want until we get the treatment that I know is going to help.
Because you see a lot, and I don't blame the doctors for this, where they're requesting care over and over and over again. And they get tired of it because they're like, well, I see this patient every month. All they do is get mad at me because I can't do anything for them.
Yeah.
And I have this utilization review denial being thrown in my face every single time I request the smallest thing, be it medication, injection, surgery, diagnosis, doesn't matter. They get tired of it. And so a lot of times, the doctors will say, look, you can keep coming to see me, patient, but I can't do anything for you.
Right.
Like I'm seeing you, I'm checking on you, asking how you're doing. I write a work status report with your work restrictions, which may or may not be helpful depending on where they're at in the case. And then they kind of move on. And I think that's frustrating for a lot of doctors. There are the doctors, though, that are like, I'm not going to say your MMI until these things happen. But that's usually up to QMEs and AMEs to kind of make that decision.
Knowing the way how the insurance company works, I wouldn't be surprised that they then get that doctor out of the MPN list. It's like, no, he's not working for us. Let's get rid of him. And then all of a sudden you get this other doctor who's not going to have your back as well as that doctor that just was literally going to fight with you. And then what? You're screwed because technically the insurance will try to find a way to just do these roadblocks because sometimes they just think, one, that you're probably lying a lot of the times because there is, and I'm not going to shade on that. There is a lot of people who try to say certain things happen at work when they really didn't. So obviously in the claims adjuster side and the insurance companies, they get lied to so much that it's kind of hard for them to even think what's right and what's wrong. But I wouldn't be surprised that they kind of push it to the limit, get that doctor out of the MPN list and then screw you that way.
Yeah, the doctors kind of got to play ball to stay in the medical provider network.
Yes.
I don't understand fully what happens behind the scenes. I never will. But, there's providers that are insurance oriented and they're, the go-to insurance doctor in their networks and things like that employers first send people to for a reason, right?
Yeah, for sure. Well, it's a sticky situation to be in regardless. I think denials in any part of a workers' compensation case can get a little bit tricky, especially if you're not even familiar with the system. Just the other day, I was in the DIR website because we were kind of backlinking one of our blogs to give some sort of information. And I went into the DIR website and I was completely lost. I was like, if I was injured, I wouldn't even know where to find the information that I needed to, let alone for denials and stuff. So I would suggest if this is something that you're going through and you're constantly battling with, it's to your benefit. You mentioned it earlier, Bilal. There's deadlines that you can completely miss without even knowing. And it's to your benefit to hire an attorney or just get a consultation and kind of get someone to give you a heads up, like this is what you can do. And, consultations are free. So I would definitely recommend getting an attorney. What else on top of getting an attorney can you tell an injured worker who's fighting denials and treatment particularly that we have not shared already?
I think a lot of people going through comp cases think that they're the only ones.
Yeah.
And a lot of people, it is their first and only work comp case. They've never been injured before, and then they have something really bad happen to them.
Yeah.
And I think a lot of times they're really shocked by how impersonal and distasteful the system actually is and how little anyone actually cares for them and what's going on with them. And I think that's really a surprise to a lot of people. They think that the insurance is going to have them covered, that, they're going to get everything they want and need to get better fast. They're going to get their benefits. And it's not always sunshine and rainbows. And even in a best case scenario, it's still flaming hot garbage. And I think it's really depressing for a lot of people to experience that. And so, for anyone who's going through a comp case, it's not just them, it's not only their case. They're not getting singled out. It's a terrible system, terrible administration. It just doesn't work for injured workers like it should. And I think it can be really frustrating. Denials are the name of the game, and we see them a lot in workers' comp for a lot of different reasons. Hang on.
Hang on real tight. And to finish the story about my dad's injury, he didn't get approved to get surgery right then and there. So what ended up happening is his tendons shrunk And by the time they did do surgery, he was already scarring. So the amount of tissue that he lost because of them not working on his finger so quickly left him with literally like his finger doing this. Like he can't move his finger, can't close his fist, like, and he also got no settlement. So that tells you everything about workers' comp. They kind of just said, stitch it up. It is what it is. That's your fate. Good luck. Goodbye. And that was it.
That's common though. We've had clients like hobbling around on broken ankles, or, common injuries like having your pectoral muscle like detach, and like it's same thing. Once it retracts too far gone, that's it.
There's no fixing it back. Yep.
Yeah,
it sucks. Well, if that's your case, we hope that you get the help that you need. You can always reach out to Pacific Workers. Check them out at pacificworkers.com. Or you can also go to the Workers' Compensation Appeals Board, to the self-help desk. They got some stuff going on. Good luck. I looked at it and I kind of see and know a lot of the stuff that happens in the firm as well. And even then I was so confused. So I would highly recommend you get a consultation. Thank you guys for joining us. Don't forget to hit the subscribe button, hit the bell notification so you guys get notified when we upload a new content. And of course, we have 2 new segments coming towards you. If you have a story to tell and you would love to be on the podcast where I can do one-on-one interviews with you and you can tell me your story, well, I would love to host you. So just fill out the form on the Work Comp Talk website and I will be contacting you. And if you have questions that you would like Bilal to answer, well, then you can ask Bilal those questions also directly on the website, or you can always put them on the comments on YouTube as well. We will catch you on the next episode of Work Comp Talk. Bye.